No, you're good.
Okay, I just turn this off because we can't run both at the same time. All right, guys, this is Dr. Eric here. If you can see him up there in the corner with the Primex stuff behind him, I'm going to let him take it away here and introduce himself and get started.
Awesome. All right, cool, guys. All right, I'm going to try to, can you guys see my screen or no?
Not yet.
Not yet. All right. I was waiting for you to guys get everything hammered out. All right. All right. Hi, everyone. Can you guys tell me if you guys see my screen now or just me?
Yep, you can see you.
Awesome. All right. Hey, everybody. Dr. Eric, Dr. Eric Fete up here in Columbus, Ohio. So I appreciate you guys letting me jump on a call and doing a Zoom presentation, talk about hormone and health optimization. So I am happy to, I want to be cognizant of everyone's time. If you need me to speed up or slow down, I'm happy to do it. I have it just most of my time, if you see my videos, I just kind of talk and I try to keep things as simple as possible by put a presentation together with a few visuals and some words and things like that. I try not to get overloaded. I try to keep it very simple and basic, but basically this title kind of says it all right: soft, tired, and sad. So this is an introduction to hormone optimization. So I'm going to teach, this is what I do with my patients. They want to get wired, they want to get happy, they want to get jacked, right? So horny and happy and fit is where we want to be. So that's kind of where we're at. So a lot of my patients come to me because of this, right? I don't know if this sounds familiar to anyone, or maybe you know someone who this does sound familiar to. They're doing all the right things. It's just not, they're kind of spinning their wheels. So libido is still down, still gaining some fat, jiggling around the middle. Body shape's not changing. They're losing muscle, fatigued, tired. They're eating, they're working out, just nothing's happened. They're like, what do I do? So I feel like I'm doing everything right. I'm working out, I'm eating clean. But just imagine, if we could change all that, get you where you want to be, get your health, not just about aesthetics, getting the body you want, but your health. And that's what I deal with too. It's what's not just what's on the outside. I want to make people healthy on the inside and feel good about themselves. My whole thing is kind of live to give. I want people to feel good, not just physically, but mentally, emotionally. So they're better partners, husbands, businessmen, wife, mothers, fathers, and they're going to pass that forward to someone else and make them feel good. So who am I? So I'm Dr. Eric. I call myself the fitness physician. So my mantra is just that. And I deal with hormonal fitness and muscle medicine, because muscle is one of the most important organs in your body. It's actually an endocrine organ. It's hormone secreting and does much, much more. So hormonal fitness kind of encompasses everything in terms of hormone optimization, health optimization, fitness, and nutrition. I get into other strategies too, whether it's gut health, functional medicine, peptide therapy, and much more. So that's what my patients come to see. It's a little picture. A little more scruffy right now because I'm doing no shave in November, but that's me, nice and clean shaven. So anyway, so I won't go through this whole list, but when people come in, right, most of my patients are, late 30s, 40s, 50s and up. I get a few patients, actually, I'm getting more patients even in their 20s and 30s, but which I'll get into reasons why. But unfortunately, it's the wear and the tear on our body. We're losing muscle, we're losing sex drive. Women are having menopausal symptoms at an earlier age, aren't sleeping. Cholesterol's off, insulin's off, blood sugar's off, their skin's changing, and why is that happening? And sometimes it's just lifestyle. You're just not getting right exercise and nutrition, but oftentimes there's some metabolic and hormone imbalances. Our metabolism changes, it slows down. Many hormones are affected, but this doesn't have to happen. We can fix that. We can slow things down. So kind of getting back to causes, right? It's the typical stuff. We're in a very toxic environment. That's why I'm seeing younger and younger patients. All the crap and toxins is in our food and our water and our environment, the stressors, everybody's working more, sleeping less, toxins all around us, stress, everybody's doing a million different things. Again, bad food, nutrient depletion in the soil. So, and that's kind of the trend, right? So it's like the current model is what I was doing when I was an emergency room doctor, is fix people when they're sick, cure a problem, pull a splinter out, crack a chest, fix things when they break, so we're treating the disease, but we're not treating the root cause. So I got into this as more of a preventive side. I want to make it more about preventing these things from happening and make you healthy. So you don't get diabetes, you don't get metabolic syndrome, you don't get obese, you don't get arthritis, all these different things. So we talked a little bit about nutrition and fitness, but hormones, oftentimes the missing piece in the puzzle, and it's readily fixable. So again, I always use my car analogy, right? It's like the gears of a machine. You got to have all these working together for the machine to turn: hormones, exercise, nutrition, supplementation, and much more. So the biggest ones that people come to me for, and that I address, are these here. Not just people think of things like estrogen and testosterone, which of course are important, but I definitely deal with a lot of the other ones too: the DHEA, the progesterone, insulin, cortisol, thyroid hormone, growth hormone. These are all massively important. Oftentimes we have to control some of these, like insulin and cortisol, we want them in the sweet spot, not too high, not too low. Women have to get a proper ratio of the female sex hormones, the estrogen, progesterone, and men have to do all of these and much more. So, suboptimal hormones are the ones that we lose as we get older, right? So as we get age, these are the reasons some of these things drop: testosterone, thyroid, growth hormone, and IGF and DHEA, all these other hormones that can drop, right? So these contribute to the loss of muscle, loss of bone, loss of bone strength, people getting fractures at an earlier age, drop in libido, skin's getting saggy and wrinkly, or tired all the time, not wanting to get up in the morning. So when we fix these things, it obviously, for example, melatonin, obviously better sleep, estrogen, progesterone, improved mood. They feel better. Patients are happier, decrease in PMS symptoms or moodiness. We can improve vaginal dryness, menopausal symptoms, and on a lot of the internal things as well, improving cholesterol profiles, reducing your risk of heart disease, which is the #1 killer of all men and women in America and the world, decreasing your risk of stroke and cancer. So again, it's not just about the outside, but it's fixing things on the inside. So again, as we age, these things all drop. And again, it's dropping even more precipitously because of what I mentioned earlier in terms of toxins and stressors and the things that we're facing that our grandparents didn't have to deal with. So all the hormones goes down, as you can see on this graph. As early as your 30s, they start to drop. Testosterone starts to drop. Strength, goes down and related to testosterone. Human growth hormone precipitously drops, even as early in their 30s. Melatonin tends to drop over time. So people have disrupted sleep. When you're not sleeping, then nothing's working. And we all know that. So the big thing for me, and I won't go through all the details on this slide, but the bottom line is there's normal and there's optimal. So I kind of liken it to a grade, right? You can pass a class as an A student, or you can pass it as a D student. I don't know about you, but I don't want to be a D student. I want to be an A student. So optimal is getting people closer to that A. And again, we're not creating supermen here. We're not like off the charts like they were back in the 60s and massive doses of all these hormones, but we want them to be good. For example, men, again, there's a lot of genetic variation, but the range of normal from roughly 300 to 1,000. I don't want my guys closer to 600 to 800 or something like that. Again, it's more important about the symptoms, but I'm just using this as an example. So a lot of times you'll go to your doctor, and I don't know if this has happened to anybody who's listening, or if you know of anybody, you don't feel well, you're tired, you're sluggish, you're gaining weight, your sex drive's down. You go and doctor says, everything's normal. What do you do? Well, something's off. Maybe it's normal. You could be 301 and you're normal, right? But that's not optimal, and that's the difference. So we want optimal. We don't want normal. So same thing with thyroid. Thyroid's a very common one. People come in. A lot of times the doctors will just check the TSH test, and it's like, well, we need to do a little bit more of a deep dive and check some other lab tests. And again, how are you feeling? If you're having all these symptoms on the screen, you're tired, you're cold, hair loss, constipation, I don't care what your labs are, I'm going to treat you for a thyroid issue more than likely, or possibly some other issues as well. That's an oversimplification, but just an example. So again, a lot of these things can contribute, right? Inflammation, liver congestion, insulin resistance, toxins, hormones, all these things contribute to what you might be seeing in the mirror. Maybe someone who's seeing this in the mirror, right? They're losing it. They're feeling tired and cranky. They feel like an old man, and they want to go to bed at 5 o'clock in the afternoon, and they're gaining weight and they're wondering what the hell's going on. So menopause and perimenopause and symptoms of hormonal dysregulation in women, again, oftentimes decreased levels of many hormones. It could be estrogen, progesterone, DHEA, thyroid, testosterone. Women tend to get hot flashes. They have problems with their teeth, gums receding, their breasts are drooping, losing muscle tone, vaginal dryness and itching. Maybe they don't want to have sex anymore because it's too painful. The bone mass is decreasing. Women are getting fractures at an earlier age. Higher risk of heart disease, backaches, losing their hair, the skin's getting saggy, many more things. Same thing with men. They can lose all these hormones as well. And everybody's probably seen this at caption before, but the guy on the right probably has it, right? He's tired. He just feels kind of moody pants, increased risk of Alzheimer's. His bones are getting thin. He's getting gained fat and losing muscle, and he's having some ED. Can't perform in the bedroom and doesn't want to have any sex. So what does all this mean? So basically all these hormone deficiency, again, I went through a lot of these, and the whole thing is, one, you could just say, yep, I'm just getting old. I'm just going to deal with it. I'm just going to go on and do my thing and feel crappy. Or you can take some responsibility and restore your levels, modify your lifestyle changes, exercise, diet, supplementation, and enjoy life. And again, it's not that we can stop aging, right? We can't make a 9-year-old, 20 again, but we could slow things down and get people feeling a hell of a lot better. It's not just about living longer, which is lifespan. It's about health span. Yeah, you're going to be 70, maybe. Yeah, you may have some creaky joints and stuff, but when I'm that age, I still want to be out skiing and walking and playing and traveling. May not be able to go balls to the wall like I did when I was 20, but I want to be out there and doing it. So it's about not just living longer, being decrepit. I want to live longer and better. So that's kind of what it's about. Some of the specific hormones, some of the things that, for example, DHEA, it's one that a lot of people don't know about. It contributes to muscle strength and lean body mass. It helps with supporting immune function, improves quality of sleep, helps with joint pain, joint soreness, improves your sensitivity to insulin. It can help with the patients, or you may have clients who are struggling with blood sugars, or their insulin, or they got a family history of diabetes or insulin resistance, or what they call metabolic syndrome, people that have abnormal cholesterol and blood sugars and they're gaining weight, etc. So DHA does a lot more things than this, but these are some, it's kind of one of the unsung heroes in my little armamentarium. We talked about testosterone, which, is a little bit more familiar for most people. Again, not just muscle mass, but it helps with the mood, decreased incidence of depression, anxiety, a better, sharper cognition, more confidence, which is going to enable you to go be a better guy or woman to do the things you want to do. Like I was talking about earlier about living to give, you're going to better mood, you feel better, you feel confident, then you're going to perform everything better, whether it's at work or at home or in the gym. Again, improving your risk of lowering your risk of heart disease, lowering your risk of inflammation, stronger bones. Inflammation is one of the biggest contributors to most chronic maladies of today's society, and estrogen, testosterone, all these hormones reduce inflammation. It can lower your risk of this. You're going to lower your risk of getting all these chronic medical conditions because of the reduced risk of inflammation and all that is associated with it. Testosterone is very helpful for women too. Sometimes women don't think about this. They think it's more the male hormone, but women need it too. And again, most of my female patients, they notice that their energy is better, more motivation, more drive, improved sleep, better memory, self-assertiveness, hit better workouts in the gym. And yeah, it can help them with body composition as well. Estrogen is massively important for men and women. Huge importance in terms of reducing risk of heart attack, stroke, osteoporosis, Alzheimer's, and more. And of course, all the symptomatic complaints too. We talk about hot flashes and night sweats and moods and, feeling blah, just kind of losing their edge. Massively important. So it's, studies have clearly shown that women who are basically optimize the hormones flat out live up to 40% longer than women who are not. That's just how long you live, not accounting for all the symptomatic benefits. Progesterone is another one, kind of moderates some of the side effects of estrogen, reduces fluid retention and bloating, reduces headaches, reduces PMS symptoms, can help with sleep. And it also protects against breast cancer and uterine cancer, similar, especially when you're taking it with estrogen. So all these things kind of put together, that's kind of what I do. I offer a whole consultation. And again, I won't go through a lot of the details on this, but just that's kind of what I do. I review my patients, their history, all their symptoms that they're having, look at their lab work, do some biometrics, and do some individualized recommendations. And we can put together a plan. And when I have patients on a plan, I can basically, it's more like a concierge practice. Where I'll follow up on them, follow everything every month, see how they're doing, make adjustments, make tweaks. You get pretty much 24/7 access to me, which anytime, anywhere. And then I follow with them every month too. So a lot of benefits, of course, again, reversing everything that we talked about earlier: improved muscle mass, loss of body fat, improved bone density, mental quality, memory, mood, sleep, and strength, and much more. So same with women. I also address a lot of things too. With a lot of my patients need everything, right? Some of them are working with trainers and nutritionists, some are not, and they need the full court press. So I'll help them with nutrition and fitness programs, help them with supplementation. A lot of my patients are deficient in magnesium or vitamin D, and I recommend some different things. I do a lot of things with peptide therapy. That's a whole nother topic for another day, but peptides are amazing molecules that can do amazing things with body composition, with mental acuity, with recovery from, especially I get a lot of patients who are wanting to work out in the gym and hit it hard and recover, and they need some help with this. And these things are amazing for healing the gut, helping resolve tendon injuries, bone injuries, just overall recovery from the gym so they can go back and crush it again the next day. So again, it's a multi-pronged approach: fitness, proper nutrition, hormone optimization, lifestyle, and much more. So, hormone optimization, that's the hallmark of what I do. And it's, it looks like this. It's very complex. It may sound simple. You read, of course, a lot of people on Instagram saying, oh yeah, do this, do that. It's just like medicine, it's very, very complex. And it's like a bunch of dominoes. You affect one thing, you affect many, many other things. It's kind of like a stewardess may know how to fly a plane, but she's probably not going to try. There's a lot to it too. In terms of these things, if you start messing with us, I've had a lot of patients come my way who've been to other kind of pill mills or clinics or just Instagram gurus, and they got messed up, and I had to fix some things. So hormone optimization is like this. It's not this. It's not just sit on the couch, do a couple injections, follow your favorite internet guru and get jacked and lean. It just doesn't work that way. So you're going to hurt yourself if you try doing that thing. So I basically help my patients find the right path. There's failure or success, and I show them better choices. What's the best way to do it? What's the best for you specifically, because everyone is different. There's no cookie cutter approach. A lot of people think I could just do this, this, and this because so-and-so did this, this, and this. It's not. Everyone's different, and there are some similarities, but there's a lot of variation too. So anyway, so if anybody's interested, I do introductory consultations and come up with a plan and can do a full evaluation if they're in person, or I do telemedicine elsewhere as well. If anybody wants to reach out to me, feel free to do so. But biggest thing, I just really wanted to just do really quick, simple introduction to hormone optimization, how to get you that lean jack body like we talked about on slide number 1. Kind of explain what it works and how it works together. That's all these things combined, as I mentioned, like the gears of the machine. So there's much more to it, but I wanted to give a very simple introduction to what I do and what I can offer. And if anybody just wants to bounce things and just fire off some questions, I'm happy to answer any questions too. So try to keep it short and simple for you guys and be cognizant of everyone's time, but happy to go into more detail with anything if anyone has any questions or comments.
Yes, yeah, I got a couple here. So why, so if most people, so we kind of understand, like if you go to a regular doctor, PT, whatever, there's difference between good doctors, good PTs, this and that. So if someone would come in with a 250 score on their testosterone level, 10 out of 10 times, what's the doctor going to tell them?
10 out of 10? Yeah. Well, it depends on what lab they're using, right? So they'll say either you're normal or not.
Okay. And why do you think there's such a big, there's a problem between like doctors understanding stuff and not? Like why would you be a better choice than, let's say, a regular doctor?
Yeah, so it's the precision medicine approach, right? I mean, unfortunately, and this is a whole lecture in itself, but unfortunately, the medical system's it's got some issues, right? So I've been there, done that in the traditional medical world. Like I said, it's great for fixing things, but unfortunately, like your primary care doctors, your family doctors, your internists, they just don't have the knowledge or the time to go through what I go through. When I have my patients meet with me, I'll spend literally 45 minutes to an hour with them, sometimes a half hour, but usually 45 minutes to an hour. And we dig deep on these questions. When you go to your family doctor, you've got maybe 5-10 minutes, and that's really about it, because they're under the incentive, because they're under the insurance clock and the mandates of insurance and capitated medicine and the political medical system that we're in. Unfortunately, it's very rigid, and it's not very forgiving, unfortunately, and it's sad, and it's broken, quite frankly, and it needs fixed. So they just don't have the time, and nor do they have the knowledge. And like for example, when I was an ER doc, I had to know a little bit about everything, but I couldn't go into detail on, someone who comes in and has a really complex, I'm not going to walk them in and come up with everything in 5 minutes. I've got 5 minutes with that patient to fix them. I just can't do everything for them. So there's just way too much knowledge out there, man. I knew a little bit about everything, but I couldn't know the orthopedic textbook front and back. I just couldn't. That's why they send, okay, I'm going to send you to a cardiologist. He's the heart specialist. I'm going to send you to the urologist. He's going to deal with your ED or your kidney stones. Same thing with primary care. I'm going to send you to a hormone specialist. That's what I do. I do that all day long. And that's my specialty. And that's what I deal with, because I'm inundated with that. I read it, live it, breathe it every day. I love it. I enjoy it. I'm passionate about it. And I'm reading stuff and learning every day, where they just can't study just that. They can't study the nuances of hormone regulation because they just don't have the time, because they have to learn everything and be able to handle everything. So it's really just a question of knowledge and time. Just like you go to a specialist for something, you go to a specialist for this, same kind of thing. And it's more of a proactive, preventive approach, right? So sometimes I can make some changes and adjustments and not even prescribe anything, just make some simple changes to prevent it more from the functional precision side. I may recommend some advanced testings that the traditional medical world just doesn't do. They don't do gut testing or microbiome testing or genetic analysis or something like that. That's where the precision approach comes in. I can dig way deeper than they can. Good examples, I went and saw a gastroenterologist because I had to get a colonoscopy, and I did a gut test, an advanced microbiome stool test. And this is a well-known guy in town, and he looked at this report for like just 10 minutes just there in the office. He ended up he didn't know what to do with it. He ended up calling me like a couple days later and say, hey, you know what? I actually read into this a little bit more, and there's more to this. And we talked for like 20 minutes. So they're just not used to doing that kind of stuff. So that's kind of the difference you get. You kind of, I hate to say get what you pay for, but unfortunately that sometimes the preventive precision medicine world on its own, outside of the capitated insurance industry, we're free to do a little bit more than what, unfortunately, they're kind of structured and what they can do. Unfortunately, they're limited.
I think it might have been during a Testosterone Tuesday talk that you gave that one of your, I guess, analogies was if you need heart surgery, you're not going to an orthopedic, you're going to a cardiac surgeon. You know, if you need hormone optimization, you're not going to a physical therapist for that. You're going to find, you know, a hormone optimization specialist.
Right. Exactly. Yeah, you got it. You know, if you want, you got to go to a specialist for most cases. If it's your run of the mill stuff, you know, I've got my ear hurts, you know, I feel good, that's fine. And don't get me wrong, there's a lot of family docs who are really good and they know a lot about a lot of things, and they can maybe, depending on their practice, they can spend a little bit more time with you. But most of them, you know, they don't, and they can't, nor do they even want to, because it's just not in their interest. For me, that's my interest. So that's why I dig a little deeper in it.
And also, can you get that information without taking blood tests?
Yeah, honestly, I mean, most of the time I can diagnose and treat just based on my spending time with the patient. That's where the kind of the art of medicine, right, is asking the right questions. If you're in my face, I can examine you from a Zoom. Obviously, I can't put my hands on you, but just most of the time it's symptom based. You know, a lot of times I don't really care what your blood work shows. I'm going to treat you based on your symptoms, what you're telling me, what kind of answers you're giving me, the questions I'm going to ask you.
All right.
But we always get some lab work anyway as a baseline, and we'll do follow-ups depending on the situation and advanced testing as well. But fortunately, you know, it's easy to get. You know, I order most of my lab work through LabCorp, and they're everywhere. A lot of the advanced tests, they'll actually ship right to my patients, so they don't even have to go anywhere. They can, like if it's a stool test, for example, or a salivary swab, they can do it right at the home and ship it out. So it makes it pretty simple. Any other good?
I think what Ryan was alluding to is there's practices around where you have personal trainers who are not doctors, giving out basically a questionnaire from the way I understand it, and based upon those answers, prescribing drops and hormone creams and putting on people in restrictive, you know, 600-800 calorie a day diets. Any thoughts on that?
Yeah. Do you want the PC version or do you want me to?
Yeah. Give it to us because this is one of my biggest pet peeves.
That is very dangerous, and that drives me nuts when I hear that kind of stuff, because that's just scary. It's scary. I mean, if you want to do that, go for it. It's kind of like the guys that I read on forums just trying to get advice and buying hormones and peptides on the black market or on an online store they saw. And same thing when I see the Instagram posts, these people that are just not qualified to be giving this type of detailed advice. I mean, you got to know your limits. And if you want to, your body and your health is not something you get one. You don't want to screw it up. And I've seen so many people who screwed themselves or had them screwed up by other people. I mean, even I work with, you know, other trainers around the country, and I think you know one of them, and she's amazing. She's very, very knowledgeable, but she still knows her limits, and she still will not give medical advice, and she'll give her advice. But hey, go talk to Dr. Eric, because he's a doc. He knows this deeper than I do. So even if you know it, if you think you know it, then just, again, send that out. Don't be prescribing stuff or recommending this. That's just, I mean, like my pilot example. I mean, I've been around. I could probably write up a legal document and an LLC document, but I'm not going to go practice law. I mean, that would be dangerous. So what you're talking about, that's, unfortunately, it's not, it's dangerous, and it's scary, unfortunately. So I know people are trying to help, and they probably have good intentions, but when it comes to your health, you get one shot. I mean, if you mess something up, that's your life, man. You don't want to mess with that.
Yeah, for sure. Does anybody have any questions? You want to drop them in the chat box or jump in here, guys? Q&A.
Yeah. Anyone else have any questions?
If you have one of those the slides here on, you had it a few back, like common symptoms of someone like the low testosterone. You can maybe bring that out there. You went through them pretty quick.
Yeah, I apologize if I went too fast.
You're good.
I don't know, Dr. E, you might be the only person that talks faster than me.
Tried to slow it down. I really did. I had a feeling I didn't want to. If I spent a lot of time, I had a feeling I was going to get because I get excited and I start talking. I'm like, no, keep pushing, because I didn't want to bore anybody with going through all the details. But there's a few slides here, but this is just some overall improvements. But I think the big ones were, I guess, with the testosterone, for example, like these, right? So
that's one of the big things. I know Allie and I've talked about, and I've heard you and Allie talk about, is depression and anxiety and testosterone, and how sometimes that's one of the underlying causes.
It is, yeah, and that's one thing I didn't really get it too deep in the woods on this one, but as I was mentioning earlier, like a lot of the internal things too, heart disease risk, inflammation, cancer. Quite frankly, a lot of hormone optimization can lower your risk of cancer. A lot of people used to think that, oh my gosh, estrogen causes cancer and all this. Well, we've clearly debunked that, and actually protects that. But yeah, absolutely. It has testosterone, estrogen, progesterone, all these have effects on the neurotransmitters in your brain, and they affect your serotonin, your dopamine levels, and much, much more. So absolutely, mood disorders, flat out frank depression, all these things can be mitigated or improved with hormone optimization therapy. Men and women. When men come in, they kind of have the grumpy old man syndrome. They're down. They don't want to do anything. They're unmotivated. They just, bleh. Like this guy, he's depressed. His head's hanging down, doesn't want to do anything. You can turn that around, with if it's just from that, it could be from other things too. Same thing with women, like we talked about earlier. Women, headaches, hot flashes, their hair gets thin. But yeah, depression, huge. A lot of women have flat out, frank mood disorders. They're depressed, they're anxious, they're irritable. They're not thinking properly. Their memory's failing them. They can't find the words. They're forgetting things. They're like, oh my God, I'm 40. I feel like I'm 80 and have Alzheimer's. They're forgetting things, and it's because of all these effects on the brain. Estrogen is hugely important for the brain in terms of protection against Alzheimer's disease, protection against dementia, and basically, memory. It helps consolidate memories, and again, reduces inflammation everywhere. So, as we all know, Alzheimer's is on the rise, dementia, heart disease, all these things. And not that these are the only things, but, hormones are a huge bulwark against these. That can prevent all these things from coming on, for sure.
Would you say too, females in their 30s and early 40s that are already experiencing menopausal symptoms like the hot flashes and the, disturbed menstrual cycles and all that, is that a normal thing, not a normal thing, something that should be addressed?
It should definitely be addressed. And I'm seeing that, I've seen that more and more in this last year too, I think. And again, same with my men. I'm seeing men in their 20s and 30s having symptoms of low testosterone. I'm thinking, man, you shouldn't, you're too young for this, but they're having it. And it could be from, again, the toxic environment we live in, stressors, medications, things like that. With women, a lot of women, as you know, are hammered on birth control pills right out of the gate. So they're on them from they're 14, 15 years old and put on birth control pills, and they come to me when they're 40. They've been on birth control pills for decades and they don't feel well. Well, that's not really a natural thing. It's just, it hijacks their system for so long. So when they do come off, they either have issues or they need some help. So, and that's another common scenario too. But yeah, if it's happening prematurely or at an early age compared to, say, your mom, your grandma, et cetera, it needs to be addressed, because maybe it's something that's reversible, and maybe a lifestyle factor or a micronutrient deficiency or a stressor or maybe higher eating. But if we address all those things, then maybe you just need earlier treatment, and that's all there is to it. And in which case it could be very helpful.
Why do you think that there's docs that, for example, for a female who has super low progesterone, rather than putting them on progesterone, put them on birth control? When I'm referencing to, say, women who've already had, a tubal ligation or an Escher procedure or something like that. So it's not even a matter of birth control anymore. It's just a matter of controlling their hormones or acne or whatever that case may be.
Yeah, sometimes it's just like the go-to, like someone comes in, oh, my stomach's bad, I'm heartburn. Oh, here's some prescription for some Pepcid, because it's quick, it's simple, they know it, they're familiar with it, and maybe it'll help, but maybe not. It may not be the best, tool for the job. You know what I mean? When all you have is a hammer, everything's a nail, right? So, there's cases where birth control pills can help. If I have a younger patient with, say, PCOS or something, it could be helpful, and that might be an option to choose for sure. But But yeah, like you said, if it's not a birth control issue, then why bother? You can use other birth control methods and treat your body naturally with bioidentical hormones, unlike the synthetic ones that are used in birth control pills that can have adverse effects because they are synthetic. We use the bioidentical ones that are more basically like our own natural hormones, much safer profile, less side effects, and better benefits. So yeah, absolutely. I see a lot of women like that. And I'm like, why are you still on birth control pills? And they always tell me, I don't know. It's just, one of those things. So well, let's try something else. So definitely much safer, more natural option to do it that way.
Yeah, cool. I'm looking for the chat box here. Anybody want to jump in? Any questions anybody wants to ask here? I know somebody mentioned the BRCA gene, and I kind of discussed it with them a little bit after our conversation, but maybe I don't know if that's something you want to touch on or kind of not really, I'm not sure.
Sure. No, that's totally fine. Yeah, there's a lot of myths and old things that just don't die. They just are hard to die, I should say. And then estrogen is a very common one with, family history of breast cancer or the BRCA gene, et cetera. The short answer is totally fine to do hormone optimization, place a woman on estrogen, progesterone, or both, or testosterone, or all three. Totally safe, totally fine, and studies have shown benefits of that. So, can you see my screen here?
Yeah.
So here's one study right here in the Journal of Nutritional Cancer Institute. Postmenopausal women with BRCA mutation, hormone therapy was not associated.
Hang tight. We're still seeing the one on menopause symptoms and physical changes.
How about now?
Nope.
Interesting. Why is that happening?
You might have to stop sharing and then share again.
Did you catch that, Dr. Eric?
Got it.
Yeah.
Thanks, Ruth.
Cool. Thank you, Ruth.
There you go. Thank you.
But I live on Zoom.
There you go. I had it on the not the my desktop. So here's a study from the Journal of the National Cancer Institute with postmenopausal women with a BRCA mutation. So hormone therapy is not associated with increased risk of breast cancer. It's actually had a decreased risk. So even women who've had breast cancer, once they're cured, totally fine. Postmenopausal women with a BRCA mutation, same thing here. Actually had a 42% relative risk reduction in the risk of developing cancer with hormone therapy. So yeah, family history, BRCA gene, totally fine. No, not an issue whatsoever.
I guess the only thing I kind of want to go back to is just like reiterate the fact too, as far as males go, just because you're in your 30s or 40s doesn't mean that there couldn't be some issues happening there with that testosterone and,
Oh, for sure. Yeah, I'm seeing, as I mentioned, I've seen younger and younger guys coming in with it, women too, with issues. And like I said, maybe it's just because of the world we live in, unfortunately, with all the plastics, the glyphosate, the crappy food, and the toxins in the air, stress, et cetera. Obviously some people come in because they've experimented with things in the past and that's messed them up a little bit. So I see that often too. But yeah, I'm definitely seeing younger and younger men. So again, as long as they're having symptoms, and it's pretty typical. I'll do blood work too, and kind of correlate with the symptoms. But if they, it's one of those things that they've got it. Age is not a discriminator for sure.
Yeah, and for the guys that are on here, it's nothing to be embarrassed about. Like, I'm not gonna lie to you. When I first met Allie, I said I met her at a speaker school thing, and I got tested. I was like 249, and the doctor's like, man, you're good. Just start taking antidepressants, this and that. Like, you guys know me. Like, I would cry watching a dog video. That shit, that's not normal. So
it's not normal for Ryan.
Yeah, it's not normal for me. But I've been on this stuff for like 2 years. I'm not gonna lie. Like, it doesn't it's not going to make you jump over buildings and stuff like that. But, I'm sharper. Like, I got more energy. It's at least worth to get tested for anybody. That's for sure.
Oh, definitely. Yeah. And that, like we were talking about with the medical world, unfortunately, it's even worse with, say, veterans, for example. I've taken care of a lot of veterans that they come out and you got PTSD, here's your Prozac and here's your Vicodin. And they feel like shit. And well, it wasn't even PTSD. They had traumatic brain injury and they had their hormones were all out of whack. And once you fix your hormones and address the lifestyle issues, man, they're a whole new person. It's unfortunate.
It's just sad. There's so much stigma around so much in the medical field, period.
There is. Well, the medical field is just like a lot of other professions. Unfortunately, there's a lot of old school theories, and you get a lot of what's called confirmation bias. You know, when doctors and people learn things in one way, they don't want to unlearn it and learn something new. I mean, look how long, you guys probably remember this, but I mean, back in, I don't know, you guys are both pretty young, but back in the 80s, it was the whole low fat craze, right? It was low fat, low fat, low fat. And now we've learned that that was a big mistake. But look how many decades it took the medical community to figure that out and realize they were wrong, that, you know, finally admit it. Oh, well, fat's actually pretty good for you, you know, things. So it takes time, but you'll see that in every industry and in every profession, unfortunately. But that's why you got to work with someone and talk to people who are on the know. And it doesn't even have to be me, but make sure it's someone who's always, I mean, I'm taking courses and reading things every single day, and there's still a ton I don't know. So yeah, you gotta stay ahead of things, because it's moving and grooving pretty fast every single day.
Got one question here from Bridget. Why is mainstream medicine so averse to this approach?
Yeah, kind of like what we were just talking about. I think it's just the traditional world. It's new, it's different. People don't like change and new stuff, right? So, you know, functional medicine or hormone therapy, peptides, all these things are kind of avant-garde and they're new. And it's like, oh no, that stuff doesn't work. I mean, natural medicine, naturopathy, and functional medicine, that's been around forever. Heck, even back in their, you know, late 1800s, it was around. And even then it kind of got poo-pooed, unfortunately, because the political and medical establishment, big pharma and insurance and everybody got involved and became a business, and they basically started controlling everything and telling the doctors what to do. Unfortunately, doctors, we gave up control of that a long time ago. So, you know, there's some cowboys out there who still do the right thing, but a lot of them are unfortunately are pushed to do certain things. They put every study they read and every conference they go to, it's just, it's sponsored by big pharma, and take your statin, take your statin, take your statin, take your Pepsid, take your Pepsid. It's just rammed down their throats. And I was there. I mean, I saw it all the time. It's terrible. And it's not necessarily their fault, but unfortunately they didn't learn to get out of that. Or maybe they do, but they just can't. Or like I mentioned earlier, they just don't have the time and knowledge to get into it, because they've got to just crank every day and see as many patients as they can just to stay alive. And they can't, you know, spend an hour each day reading about hormones and spend an hour with their patients. They just physically, literally, and financially can't do it. So, but as I mentioned earlier, there's a lot of economics and there's a lot of politics involved with it, which is unfortunate, because it hurts the patients. It hurts all of us. So that's why I do what I do, and a lot of my colleagues do what we do, because we're trying to fight that and as much as we can and keep it alive and help as many patients out as we can.
Any other questions there, guys? A few seconds here.
About if you want to put your contact information up there again, in case someone wants to contact you guys here. Again, I want you guys to understand, like we're you know, we have him talking today. Allie was talking last month or maybe 2 months ago. We just want you guys to be aware of all this stuff. Like, there's a lot of stuff that goes on. Her and I, we are not the answer for everything.
No, definitely.
Okay, so it's good to be able to you know, get guys like him to kind of help us out. You know, put it this way: if we bring someone on, we trust them. So, you know, if you guys got questions or concerns about anything, you know, give them a shout. I'd rather you guys do this than go to GNC and, you know, ask the guy behind the desk, because he'll feed you a bunch of bullshit.
Yeah, please.
Mike might even be listening.
Yeah. Sorry, Mike.
Yeah, I'm happy to help. If you follow me on Instagram, I put out a lot of free content, give a lot of stuff away all the time, but I'm happy to do consultations. If you want to do a formal consultation, if you just want to bounce something off me, ask me a question, fire away, find me on the website or on Instagram. Happy to help answer questions or give advice or whatever, anytime.
Sure. Cool. Doesn't look like there's any more questions. We won't hold you up here all night. I know you had a long day as well.
Yeah, I'm sure you guys did too. Thank you so much.
Yeah, definitely. Thanks for coming on.
I appreciate you having me on, guys. If anybody has any questions, like I said, I'm happy to help.
Thank you.
All right. Thank you. Yep.
Thank you.
Have a good night, everyone. Thank you.
Thank you. Take care.